Gestational diabetes develops when a woman cannot produce enough of a hormone called insulin during pregnancy. It can lead to a range of complications. However, it is possible to reduce the risk of gestational diabetes by following a healthful diet and achieving or maintaining a moderate weight. If the body has lower levels of insulin than it needs, this leads to high blood sugar. Without treatment or management, high blood sugar levels may cause problems for a woman and her baby. In this article, we explain the type of diet that an individual should follow during pregnancy if they have gestational diabetes, including which foods to eat and avoid. We also consider other treatment options for gestational diabetes and the possible complications that may occur. Foods to eat. Following a healthful diet is important during pregnancy, particularly if a woman develops gestational diabetes. For this reason, pregnant women should follow their doctor's or dietitian's recommendations and avoid trying to create their own meal plan. High blood sugar levels during pregnancy may be harmful to both the woman and the growing fetus. It is important to monitor how many carbohydrates are present in the diet, including the type of carbohydrate and the frequency of consumption, to help manage blood sugar levels. Keeping a food diary may make this easier. It is also important for women with gestational diabetes to monitor and log their blood sugar levels according to a doctor's directions. Most women will need to check these levels in the morning and between meals. The results can indicate the amount and type of food that is safe for them to eat. Avoiding foods that may excessively raise blood sugar levels is essential if a person is following a gestational diabetes diet. Blood sugar levels increase when people eat sugary foods, particularly those that have undergone refinement or processing. Women with gestational diabetes should avoid or limit sugary foods as much as possible. Cakes, cookies, candy, desserts, sweet pastries, soda, ice cream and fruit juice with added sugar. Women with gestational diabetes can enjoy milk and fruits in moderation, even though they contain natural sugars. Avoiding highly starchy foods. Starchy foods are high in carbohydrates and can have a significant effect on blood sugar, so it is important to eat them only in small portions. It is best to avoid or limit very starchy foods. What is gestational diabetes? Gestational diabetes is a type of diabetes that can develop during pregnancy. According to the Centers for Disease Control and Prevention (CDC), gestational diabetes affects 2 to 10% of pregnancies each year in the United States. This type of diabetes occurs when a woman's body cannot make enough of the hormone insulin. The pancreas produces insulin, which helps the body's cells use sugar from the blood as energy. When a woman is pregnant, her body will produce more hormones, and she may gain weight. These changes may result in her body's cells using insulin less efficiently than they did previously, which is called insulin resistance. Becoming resistant to insulin means that the body needs more of this hormone to handle the sugar in the blood. Sometimes, the body cannot produce enough insulin to keep up, and this leads to a buildup of sugar in the blood. For more details, please visit our website and link in the description. Thanks for watching this video.